So I'm the Clinical Program Director for Intensive Treatment Systems. I oversee all of our programs as well as all of our staff members. I work with running especially our intensive outpatient programs and groups. That's part of my baby. That's where I have seen the most change in patients, is engaging them in that group setting as well as in individual counseling, because our patients' medication-assisted treatment only goes so far if you're not adding in the cognitive behavioral therapies that help support the changing of the behaviors and the thoughts, and not just the cravings that physically are attached to someone who's struggling. And so by helping them learn the different means of how to express themselves, how do you tell somebody in your family that I'm struggling with how I feel right now, I'm anxious, when most of the time I'm so used to using my defense mechanisms and showing my anger instead of really expressing myself, and being able to work with patients to be able to get them to understand that there's a whole nother language out there. There's a whole bunch of more options for behaviors and attitudes associated with going into recovery. When it comes to working with our patients and their families or their outreach, family's not always defined by blood. It's defined by what I conceptualize my family to be. So we encourage families to come in and help support the patients. We do family counseling with the patient. Sometimes we even just give resources to the family members who are at a loss. Maybe their family member has decided to relapse and they don't know which way to turn or where to get that support from. So we can be that person that they can come into and ask the questions, and then we can get them set on the trail to where they're healing in the same process while they're waiting for their family member to get back on track. So ITS has definitely grown. Just within the last 2 years, we've grown and changed. We started out as a methadone clinic, period, across the board. We've been in business for more than 30 years, and we currently have 3 clinics that are located here in the Phoenix area. We have signed the lease in a property in Santan, so we're gonna be opening up a 4th clinic. We have now grown to where we actually offer methadone, Suboxone, and Vivitrol as part of our treatment, not just methadone anymore. We've offered in transportation. We also offer in individual counseling as well as in group counseling, as well as family counseling. And here at this clinic, we've actually gone 24 hours a day, which is outside of the typical methadone clinic that only worked from, say, 4:30 to 11:30. So we're really trying to work hard on meeting our patients' needs. We've also added in peer support. The role that peer support offers to someone who's currently struggling is so valuable. They can be there and say, I've been there, done that, and I came to the other side, and this is what you have to look forward to. And when you've got someone who's struggling, who wants to look at a clinician and say, you know what, you have no idea what I'm going through, to be able to talk to somebody who has is remarkable, the change that takes place within the patient. Because now they feel like they're being heard, their voice counts and matters, and it gives them hope to continue on. The other great thing that we're adding in is here we've added in behavioral health services, as well as we are working toward getting integrated care, which means having primary care in-house. That's our next step, because if we can address the total person, our bodies, our physical, our emotional, our behavioral, as well as our substance use disorders, we're going to see people change for the better. To me, every patient that walks through our door or picks up the phone and calls us is trusting us with their lives. If you walk through one of our clinics and you ask any one of our staff members, what's your goal for today? Every one of them will say saving lives, because that's the impact that we have with each and every person we come into contact with. We're not an emergency clinic, we're not an urgent care, but to help somebody making the choice not to use today is just as impactful. I tell everybody there's 1,000 ways to recovery, but only one way to get there. Whatever it is that it takes to work today in this moment and in this situation, there's no wrong way to get to recovery.